Welcome to Indiana News Desk. I'm Joe Wren. Well, after a tumultuous 18 months, schools are hoping to return to some sort of normalcy this academic year. Last year, Governor Eric Holcomb issued guidance about social distancing, quarantining, and masking in schools. But this year, he's left those decisions to local school boards. And that has led to a patchwork of policies across the state. Ethan Burks joins us now on set to talk about how Monroe County is approaching this school year.
Thanks, Joe. You know, school districts now have lots of data that show in-person learning is much better for students than virtual learning. This is forcing schools to take a hard look at tweaking their quarantine policies, and in a lot of local districts requiring masks in an effort to keep their buildings open. But that can be tricky because some people still question the effectiveness of masks, and others worry that quarantine policies are too vague to really protect vulnerable children who still aren't yet eligible for that vaccine. Mask mandates are a contentious issue, even in schools where the CDC has advised all students wear them when they're in close contact with each other. During this week's Monroe County Schools board meeting, a group of parents were outraged that their kids still have to wear face coverings.
What about parents? You have to follow the rules.
One meeting attendee refused to wear her mask, and a school resource officer forced her to leave.
We shouldn't have to put adults into timeout, so I'm hoping that we can follow the rules and wear the masks and speak in turn so that we can have public comment.
The district is mandating masks for students, faculty, and staff regardless of their vaccination status. People are also required to follow a 3-foot social distancing rule. The district's new COVID policies eliminate the metrics that were used last year to determine if students were learning in person or online. Those metrics were based on the county's overall positivity rate.
That percent positivity now is not an accurate picture of the risk in our community because of changes in the number of people who are getting tested, as well as the nature of the reasons that people are getting tested.
Cooperman is also on the district's COVID-19 monitoring and advisory committee, along with pediatricians from IU Health, local health officials, and educators. It was this group that decided the old metrics were outdated and needed to be replaced.
When these metrics were designed, we didn't have vaccines for everyone over 12. The professional organizations weren't sort of speaking in unison about the importance of in-person learning.
So instead of looking at the community's positivity rate as a whole, the committee will evaluate schools and classrooms individually based on positive cases and conduct contact tracing from there to see who has to quarantine. MCCSC says this gives them extra flexibility to avoid moving the entire district back to online learning for unrelated COVID outbreaks in separate schools.
I appreciate this. I know that things are always changing, but the vagueness does worry me a little bit.
Schur and fellow school board member April Hennessy say they're concerned the policy lacks specific details as to how the district will handle positive cases when they occur.
If you have a positive individual in a home, are siblings still allowed to go to school? If you have a sibling who's a close contact, are you then a close contact? I think these are things that parents still don't have clarity on.
District guidelines say schools will be following the Indiana State Department of Health's definition of close contacts. The state defines a close contact as someone within 6 feet of an infected person for at least 15 minutes within a 24-hour period, and that period starts 48 hours after that person started feeling sick, because we now know that's when symptoms develop. Once it is decided that a child must quarantine, they may only return to school after a negative PCR test, medical clearance from a doctor stating a different illness, or isolate for 10 days. Fully vaccinated students and staff will not be required to quarantine or be considered as close contacts.
Our experience during the past school year and thus far this school year indicate that our mitigation measures are providing a low-risk environment for students in the classroom.
The Monitoring and Advisory Committee will continue to reassess the policy throughout the school year and make changes as needed, especially with the evolution and spread of the Delta variant. MCCSC says it will not publicly disclose quarantine information, but the number of positive cases district-wide will be reported every Friday throughout the school year. And Joe, the latest numbers are showing 44 cases across 12 different schools.
All right, Ethan, thank you very much. And